Lesson 3. In this lesson, we will discuss COVID-19 with regards to stress and coping and family support.
Let us now look at stress and coping. The National Center for Post-Traumatic Stress Disorder outlines 4 keys of stress that healthcare workers often experience in disaster situations. Firstly, the need to employ strict biosecurity measures. The pressures regarding procedures that must be followed can result in a lack of spontaneity. Secondly, the risk for disease transmission, where infection control is a significant concern. Third, the multiple medical and personal demands. The complexity of responding to COVID-19 may result in conflicting personal and professional demands. Lastly, the stigma. There is a struggle with the healthcare workers regarding their own fear of contact with patients with COVID-19 and finding it difficult to speak about their fears and their needs. The healthcare workers need to adhere to strict guidelines in ensuring infection control procedures are being followed. The constant vigilance is critical because of the nature of the disease and its ability to spread so rapidly, resulting in a high disease burden. This, however, can be very exhausting and stressful for the staff. In certain areas, there are physical distancing or isolation, and this can create a sense of loneliness for the healthcare worker. The physical strain of wearing personal protective equipment or PPE for long periods of time can be very stressful, and the staff can experience dehydration, heat, or exhaustion. The healthcare worker struggles with fears that they might infect their loved ones and also be isolated from their loved ones. There is also the patient assignments and workloads that can be very demanding. Added to this are the challenges of limited resources. All these can add to the complexity of the already complex disease. Let us now look at things that a healthcare worker can do to decrease stress or to cope with stress. They can monitor themselves by monitoring their physical, emotional, and mental well-being and plan their tasks so that they do not feel overwhelmed by doing everything at once. By regularly checking in with their colleagues, families, and friends, they can reduce the feelings of isolation and have some sort of normality. Working in partnership and teams will help them to support one another. A break can clear the mind and reset one's mood. It also promotes well-being and reduces stress. Peer consultation helps to reflect on practice, and this can also help to build self-esteem, confidence, and positive feelings, and this can reduce stress. Taking time to care for oneself can also help because in order to care for others, we first need to care for ourselves. Focus on factual information and participate in decision making. This will help and reduce mental stress. Keep the anxieties or limit anxieties to what is actually factual and what is going on at the moment. Do your best to maintain helpful self-talk and avoid overgeneralizing fears. Focus on efforts on what is within your power, especially in this trying time. Accept situations you cannot change, especially when it is so difficult. Due to the current situation, it's very easy to become impatient and intolerant, especially with our colleagues. And also, it's very easy to lose hope, especially when we see the statistics in terms of how this disease is progressing and the effects it is having globally. However, by adopting these techniques, we can still foster a sense of hope by being a little bit more patient and tolerant with one another and encouraging one another during this time. Let us now look at things to avoid. Working too long by yourself can lead to self-isolation, which can cause loneliness and depression and other stress and mental disorders. Working around the clock not only decreases productivity and efficiency, but also leads to a lack of concentration, and it increases risks. The feeling that you are not doing enough when you know that you are already doing the best that you can. Avoid excessive intakes of sweets and caffeine, and avoid engaging in self-talk and attitudinal obstacles to self-care, such as it would be selfish to take time to rest. The needs of survivors are more important than the needs of helpers. Only I can do. Family support for patients during hospitalization is very important to decrease anxiety and stress, especially because there are no visiting hours. We can encourage visiting through virtual visiting by patients using their cell phone or, if possible, offering a laptop where they can connect with their families and have some sort of communication and be able to see their families. This will relieve their stress and anxieties. Thank you.